We continue with diagnosis through the lips, and this time we talk about physical changes. The lips are closely related to the spleen, which is the root of the acquired constitution. The health of the human body can thus be judged by observing the lips. The physical state of the lips is inseparable from that of the mouth. The physical state of the lips are judged by their shapes, whether they are dry or moist, or whether there are bumps or sores on the lips, along with other factors. For example, dry lips are caused by fluid depletion due to dryness heat, and ulcers on the lips are often the result of hyperactive fire or a viral infection. Behavioral changes in the mouth, such as a crooked mouth and lips, are also symptoms of abnormality. The lips are red and swelling, as you can see in the picture, with a sore on the highest part of the swelling. And the sore is hard and painful, which results from the clogging of evil toxins. Herpes on the lips. Small ulcers are growing on the lips with the yellow fluid, and scabs that develop in a few days are a sign of the onset of cold, pneumonia, or measles. Cracked, dry lips. The lips are dry and cracked with small flakes on the surface or even deep cracks. This is the result of fluid depletion due to dryness heat. Lockjaw. Diseases such as epilepsy and tetanus and acute infantile convulsions could all be the cause for lockjaw. Drooping mouth with the tongue deviating to one side and often accompanied by drooling is likely a sign of facial paralysis or cerebral stroke. Tips for caring for your lips. For pale lips, this often results from insufficient blood and qi, leading to failure of the blood to nourish the lips. Consume a diet rich in iron. For example, eat foods such as animal livers and spinach more often to replenish the blood. In addition, exercise on a regular basis to be physically strong and promote the circulation of qi and blood. Pale lips are often seen in people suffering from anemia. The San Yin Jiao point can be massaged frequently to replenish the spleen and augment blood, regulate liver and tone the kidney, replenish qi and nourish blood. Frequent massaging of the San Yin Jiao point will help relieve anemia caused by insufficient blood and qi. It also works quite well for women suffering from anemia due to menorrhagia and postpartum hemorrhages. For dry, scaly lips, drink more water to replenish body fluids in a timely way. Apply lip balms to keep the lips moist and prevent them from flaking. Consume a diet rich in fresh vegetables, fruits, and supplementary vitamins. Do not lick your lips because that will make them even drier. In addition, massaging the Susan Lee point can help invigorate the middle burner and augment qi and clear the meridians and collaterals to promote circulation of qi and blood. Use the pads of both thumbs to press the Susan Lee point alternately until a distension is produced. Do it 30 to 50 times a day until a localized distension is felt. Long-term massaging of this point can help keep your lips red. Thank you for your attention.
Let us go to interviewing. The topic is types of pain and their pathology. So here we will look at the type of pain and its characteristics and what pattern it is. So if the pain is soreness, that's a dull ache that usually occurs in the forelimbs or trunk. That is a pattern of deficiency condition or dampness. When the pain is with feeling of heaviness, it will be a dull ache accompanied by a sensation of heaviness. This usually occurs in the limbs, head, or the whole body, and that is a pattern of dampness or phlegm. When the pain is distending or there's bloating, it will be a subjective bloating sensation. Bloating may also be felt on palpation when the area feels distended like a balloon and seen on observation, and that is qi stagnation. When there is pain with feeling of fullness, the patient will feel very full as if after a heavy meal, perhaps also with a slight nausea, and the area feels hard rather than distended on palpation. Fullness cannot be seen on observation, and that is a pattern of dampness. When the pain is an ache with feeling of emptiness that often occurs in the head, that is qi and blood deficiency or kidney deficiency. When there's pain with the feeling of cold, it will be a sharp or stabbing, or spastic pain that is clearly accompanied by a pronounced feeling of cold or even shivering, and that is alleviated by the application of heat. That pattern is full or empty cold, and usually in abdomen or limbs. When there is burning pain, it's a pain with a burning sensation. That's a pattern of full or empty heat, usually in the epigastrium or in the limbs. The next type of pain is colicky pain. That's a sharp pain of the colic or cramping nature. The pattern is cold in the intestines, blood stasis, usually in the epigastrium, or more usually the lower abdomen. When there is spastic pain, that's a sharp pain accompanied by spasms or contractions, or a sensation of spasms, which is a pattern of liver blood deficiency in conjunction with liver qi stagnation or liver yang rising, usually in the limbs or head, and is related to the sinews, and therefore the liver, either of a full nature or a combination of deficiency of liver blood and fullness of stagnation of qi. The next type of pain is dull ache, which is a very mild pain. It's usually a deficiency of usually chronic of long duration pain. Next is pain with distressing feeling. That's a pain accompanied by a restless and undefined anxious feeling and perhaps palpitations, usually in the epigastrium or chest. That's a pattern of retention of phlegm in the epigastrium affecting the heart and rebellious qi in the penetrating vessel. Next is pain with a sensation of stuffiness. It's a pain with a mild feeling of fullness while the abdomen feels soft on palpation, usually in epigastrium or the chest. That's a deficiency of the spleen and fullness of heat or phlegm. Now, next is the pushing pain. That's a sharp pain accompanied by a feeling as if something was pushing the area, usually in the hypochondrium or epigastrium, and that is a severe qi stagnation. Next is pulling pain. Pulling pain is a sharp pain accompanied as if the skin were being pulled, usually on the head, and that is a pattern of liver wind. Next is cutting pain, which is a very sharp pain that feels like a knife, usually in the lower abdomen. That's blood stasis and definitely full in nature. The next type of pain is throbbing. That throbbing pain is a severe pain. It feels as if there was a throbbing or pulsation, usually on the head, very common in headaches from liver yang rising. Next is the boring pain. Feels like the stabbing of the tip of a knife blade, a nail, or a screw. It is fixed in its location and usually in the lower abdomen, epigastrium, hypochondrium, chest, or head. That is a pattern of blood stasis that is full in nature. Next is lurking pain. That is pain that is not severe, not acute, relatively easy to endure, but chronic and persistent. In Chinese called yin tang, which means latent, hidden, or lurking pain, usually improves with the application of heat, generally in the abdomen or lower back. That's a pattern of qi and blood deficiency or empty cold in the interior, leading to malnourishment of the channels. Now let's look at the time of pain. When it is a daytime pain, it is usually due to a dysfunction of qi or blood. When it is at night, it is due to a deficiency of yin or blood stasis. Intermittent pain is due to either qi deficiency or qi stagnation, and continuous pain is due to blood stasis. Thank you so much for your attention.
Let's now proceed to pattern discrimination with the second part of models for pattern discrimination. Pattern discrimination is done based on a series of models or categories that highlight different aspects of the condition and its relationship with body function. In clinical practice, complex patterns are defined through a combination of these categories. These kinds of presentations are very common. Combined Zhang-Fu 8 principles and Qi, blood, and body fluid pattern discrimination is most frequently used in clinical practice. TCM ascribes patterns to the patient condition rather than making the patient's condition fit the pattern. Patterns most frequently seen in modern TCM practice are as follows. 1. Liver qi stagnation. 2. Liver qi stagnation and spleen qi deficiency. 3. Liver and stomach disharmony. 4. Insufficiency of liver blood. 5. Hyperactivity of liver yang. 6. Liver wind steering internally. 7. Liver and kidney yin deficiency. 8. Heart spleen dual deficiency. 9. Heart and kidney not interacting. 10. Spleen chi deficiency. 11. Spleen kidney yang deficiency. 12. Food stagnation in the stomach and epigastrium. 13. Stomach chi counterflowing upward. 14. Wind cold invading the lungs. 15. Lung kidney yin deficiency. 16. Lung qi and yin deficiency. 17. Large intestine damp heat. 18. Kidney qi deficiency. 19. Kidney yin deficiency. 20. Kidney essence deficiency. 21. Kidney yin and yang dual deficiency. 22. Urinary bladder damp heat. 23. Qi and blood deficiency. 24. Blood stagnation. And 25. Phlegm turbidity obstructing the middle. To summarize, TCM pattern discrimination provides a more holistic approach to diagnosis and treatment. It focuses on determining the functional relationships that give rise to disease. Pattern discrimination consists of a comprehensive analysis of symptoms and signs, as well as an appreciation for the relative strength of the body's resources against the pathogenic factors. Identification of the underlying pattern of disharmony allows the practitioner to determine nature and location of the disharmony, treatment principle and techniques, as well as a prognosis for the patient. Symptoms and signs have meaning only in relation to all the others. Treatment can be tailored to the exact needs and characteristics of each individual patient. Pattern discrimination can also be employed to identify constitutional tendencies and mild disharmonies in generally healthy individuals, allowing the practitioner to deliver preventative treatment. Thank you for your attention.
We go to differential diagnosis, both Western and Chinese medicine for cough. We start with Western differentiation for cough. 1. Stemming from lung pathology. Upper respiratory tract infections, including influenza. This will be characterized by acute hacking cough, dry cough or with sticky yellow sputum, difficult to expectorate, mild fever, nasal obstruction, sore, dry, scratchy throat, thirst, headache. Next is bronchitis. For acute bronchitis, we have dry irritating cough with retrosternal discomfort, tightness in chest, white scanty thick sputum. For chronic bronchitis, cough is worse in the morning and late at night, yellow sputum with increased breathlessness, wheezing, blue. These patients are referred to as blue bloaters. Third is bronchiectasis. There is persistent dilation of the airways leading to cough with copious yellow or green sputum, hemoptysis, bad breath, finger clubbing. Asthma, there will be dry or scanty nocturnal cough, tightness in chest, and wheezing, breathlessness. Cough due to lung cancer will be persistent. There will be hemoptysis, breathlessness, and pain. Other causes would be whooping cough, pneumonia, pulmonary tuberculosis, lung abscess, HIV infection, cystic fibrosis. Second, cough stemming from heart pathology. First is left heart failure. Cough and breathlessness, especially on exertion and when lying flat, wheezing, pink frothy sputum may be produced. Second, mitral valve regurgitation. Failure of mitral valve to close, allowing reflux of blood from left ventricle to left atrium, leading to breathlessness. Now let's go to Chinese differentiation for cough. We diagnose according to first organ interrelationships. So we have the Shang cycle relationship between the lung and spleen, the tie-in channels. Then we have diagnosis according to the type of cough. It is a deficient pattern if it is weak sounding, heat if the cough, it's a barking type of cough, phlegm if it's loose, rattling, phlegm heat if there is yellow sputum, and cold phlegm if the sputum is white. In deficiency, the cough is worse in the afternoon or evening, heat or dryness if it is worse in the daytime. Spleen or kidney deficiency, phlegm dump if the cough is worse at night, and hyperactive liver chi if it is worse with emotional upset. Then we diagnose according to symptoms of phlegm. So for location, so it's either throat or chest. Then for the cough, we categorize if it is dry, productive, loose, weak, or forceful. Color or nature of phlegm, clear, thin, watery, is cold, yellow, thick, white is heat, blood tinged, deficiency, fire, lung heat, dryness, heat. Purple block, it's blood stasis, scant, heat, dryness. Copious, easily expectorated is dampness. Now, for etiology, so we have external pathogenic factor, emotional stress. This can be too much thinking, sorrow, anger. Then diet, excess sweet, greasy, or dairy food, injuring spleen, chronic illness. So for the Zhangfu patterns, external, wind cold invading lung, wind heat invading lung, wind dryness invading lung. Internal, so for excess, we have lung heat, phlegm dump, phlegm heat obstructing the lung, and liver fire blazing. For deficiency, lung or spleen qi deficiency, lung yin deficiency, spleen yang deficiency, kidney yang deficiency, lung kidney yin deficiency. Thank you for your attention.
Let us go to Fu viscera and irregular organs. The topic is urinary bladder. The urinary bladder is a Fu organ located in the lower abdominal cavity. It is a hollow sac-shaped organ. Its upper end is connected to the kidneys by the ureters and its lower end to the urethra, which opens into the external genitalia. Its main function is to store and discharge urine. The metabolism of water is carried out by the joint actions of the lung, the spleen, and the kidney. After water has been transformed into body fluids, it is distributed to the entire body to nourish all the organs and tissues. The fluid that remains after the metabolic process is transported back to the kidney, whence it is conveyed to the urinary bladder as urine. The urine is stored in the bladder until it reaches a certain volume. At that point, by means of the transformation of kidney qi, it is excreted under voluntary control. Thus, the plain question states, the urinary bladder is the reservoir officially in charge of the storage of body fluid. When bladder qi is transformed, the urine is discharged. If the transformation of bladder qi fails, the opening and closing of the bladder become uncontrolled. If bladder control is lost, there may be frequent urination or incontinence of urine. Clinically, this is managed by treating the kidney. If dampness, heat obstructs the bladder, there may be urinary urgency, frequency, and painful urination. Here, let us look at the urinary bladder. So its function is to store body fluids and control storage and excretion of urine. But when there's failure of transformation of urinary bladder qi, it can lead to abnormal urination, like impleted urination and retention of urine. It can also cause abnormal color of urine, like hematuria, chyluria, and cloudy urine. And it could also lead to abnormal urine volume, like polyuria, oliguria, and anuria. The urinary bladder, a capsular organ, is located in the center of the lower abdomen. The urinary bladder and the kidney are interiorly and exteriorly connected via their meridians. The main physiological functions of the urinary bladder cover two aspects. Number one, it is in charge of storing urine. Under the qi transformation function of the kidney, the body fluid are changed into urine and stored in the urinary bladder for a period of time. This function relies on the qi transformation function of the kidney and urinary bladder, as well as the consolidation astringency function of the kidney qi. If the urinary bladder fails to control or the kidney qi fails to consolidate and astringe, there will be profuse urine at night, and uresis or incontinence of urine, etc. Number two, it is in charge of excreting urine. When the volume of urine in the urinary bladder reach a certain degree, the urinary bladder will be full and there will be micturition desired under the influence of qi transformation by the kidney and urinary bladder. The urine will be discharged out of the body. So the function of urinary bladder to discharge urine relies on the qi transformation by the kidney and urinary bladder. If qi transformation fails to function properly, there will be unsmooth urination, difficult urination, or retention of urine. Thank you so much for your attention.
Let's now go to diagnosis according to Zhangfu organ patterns, worms in the small intestine. Worms in the small intestine cannot be treated with acupuncture. Its etiology is in indigestion of contaminated food, poor hygiene, and inadequate cooking of food. Its symptoms and signs: abdominal pain, abdominal bloating, pale and sallow complexion, weight loss and poor growth in children, vomiting of worms, strange cravings, anal or nasal itching, insatiable hunger. These symptoms: weight loss, lack of growth in children, insatiable appetite. Treatment principles: kill and expel parasites. A relevant advice here would be to observe better hygiene and preparation of food. To summarize, infestation of worms in the small intestine has its etiology in infestation of intestinal worms, excessive consumption of cold and raw foods. Underlying and accompanying pathology: cold condition of the spleen and intestines, which allows the worms to thrive. Signs and symptoms: abdominal pain and distension, bad taste in the mouth, sallow complexion. If there are roundworms, there will be abdominal pain and vomiting of worms and cold limbs. If there are hookworms, there is a desire to eat unconventional things like soil and cooked rice or tea leaves. If there are pinworms, there will be an itchy anus, worst in the evening. If there are tapeworms, there will be constant hunger combined with weight loss. Our acupuncture treatment instead would be herbal medicine is the treatment of choice. So herbal treatments here would be neem pill, regulating the center and calming roundworms decoction, mycorrhiza neem calming roundworms decoction, and dissolving parasites pill. Thank you for your attention.
Let us go to etiology in Chinese medicine. The topic is traumatic injuries. Traumatic injuries. This category is very broad and includes injuries from falls, gunshots, sharp or blunt objects, animal bites, sports injuries, burns and scalds, frostbites, and many others. Such injuries often cause wounds, painful swelling, bleeding, bleeding under the skin or in the muscle, blood clots, bone fractures, sprains, or tears of sinews. In severe cases, there may be additional injury of internal organs or massive hemorrhage. In such cases, there may be yin depletion or yang collapse, leading to coma, shock, or even death. In mild cases of burns or scalds, the damaged area will immediately appear red and swollen, with sensation of pain and warmth, and blisters may occur. In severe cases, there may be injury to the muscles, sinews, and bones. The burnt area may look like leather or white wax or have a charred appearance. In even more severe cases, the burn area may be very large. There is serious damage to the body fluids, and the fire evil attacks to the interior, with resultant agitation, restlessness, fever, thirst, oliguria or anuria, or even death. Frostbite refers to general or local injuries caused by prolonged exposure to cold, or exposure to extreme cold, or contact with a very cold object. Here we can see the different types of traumatic injuries like burns, gunshots, accidents, fractures, traumatic injuries, wounds by sharp metal things, or it could be bite by insects or animals like wasps, poisonous snakes, or dogs. Bites by insects and animals, including poisonous snake, beasts of prey, rabid dog, and stings by scorpions, wasp, or bees may cause local wounds. In mild cases, there may be localized swelling, pain, laceration, or bleeding. In severe cases, there may be severe laceration and bleeding in the internal organs, as well as in the skin. There may be massive hemorrhage leading to death. Bites by poisonous snakes will have, in addition, symptoms of poisoning by the venom in the whole body. If not treated in time, death from the venom may ensue. Bites by rabid dogs may at first be manifested only by pain and bleeding in the wound. Even if the local wound heals, however, symptoms of rabies may appear after a latent period. These include agitation, fearfulness, convulsions, and fear of water and of wind. In some cases of traumatic injury, There's lockjaw and tetany may appear and the progressing to death. Thank you so much for your attention.
We talk about the emotions this time. Craving. As explained, craving should be seen in the context of the three major philosophies of China: Confucianism, Buddhism, and Taoism. All these three philosophies considered craving and desire as the root of mental emotional suffering. In the context of Chinese medicine, craving indicates a state of constant craving that is never satisfied. This can include craving for material objects or social recognition. Although rooted in the ancient philosophies of China, it is interesting to note that craving as an emotional cause of disease is common in our Western consumer societies, where not only is there craving, but where this is also artificially stimulated by advertising. So here is the clinical picture of craving. There is slight manic behavior with insomnia, mental restlessness, red face, palpitations. Craving affects the heart and it scatters qi. Craving also affects the pericardium by stirring the minister fire. In disease, minister fire refers to a pathological excessive empty fire arising from the kidneys. It arises from the kidneys and it affects the pericardium and therefore the mind. For this reason, minister fire refers to the physiological or pathological fire of the kidneys and to pericardium. This accounts for the assignment of the right rear position on the pulse, either to the kidney yang by some doctors or to the pericardium by others. So here we see the effect of craving. So it makes the minister fire rise to the heart and pericardium, leading to either heart fire or heart empty heat. If the mind is calm, settled, and content, the pericardium follows its direction and there is a happy and balanced life. If the mind is weak and dissatisfied, the pericardium follows the demands of the craving and the person constantly desires new objects or new recognition, which, even when attained, is never satisfying and leaves the person more frustrated. It is for these reasons that Confucianism, Taoism, and Buddhism put the emphasis on reducing craving to prevent the arousal of minister fire, which stirs the mind. Craving will cause heart fire or heart empty heat, depending on the underlying condition of the person. If it causes heart fire, there will be palpitations, red face, stirs, insomnia, agitation, and slightly manic behavior. If there is a tendency to indeficiency, which is common in people who tend to overwork, it will lead to heart empty heat. This will cause palpitations, a malar flush, dry throat, insomnia, and mental restlessness. Let us summarize. Craving. This should be seen in the context of the three major philosophies of China: Confucianism, Buddhism, and Taoism. All these three philosophies considered craving and desire as the root of mental emotional suffering. In the context of Chinese medicine, craving indicates a sense of constant craving that is never satisfied. This can include craving for material objects or social recognition. Craving affects the heart and it scatters the qi. Craving also affects the pericardium by stirring the minister fire. Craving will cause heart fire or heart empty heat depending on the underlying condition of the person. Thank you for your attention.